Hey guys, Dr. Slaughter here. I'm a dual board certified facial plastics and hair restoration specialist. So what I wanted to do for you guys is give you a couple of non-graphic demonstrations with using models, right? That will show you the difference between FUE and FUT, or the strip, right? So we can get a little bit more detail and clarity of true information instead of maybe some of the misinformation that's out on the internet. Speaking of, I did do a podcast with the great friends and the phenomenal John Wheeler, Alpha CEO, where we get very detailed into hair. We go back and forth with the FUE versus FUT, so you get some really good information. So we'll put a link in the post. Check it out. If you have any questions, please drop us a line or certainly call us if you want a consult, but we'll get right into it. Hey guys, so we always get questions for clarity on FUE versus FUT and how that looks practically. So I figured I would show how that works with the model, right? I did release a podcast with John Wheeler, which was phenomenal. If you guys haven't had a chance to check that out, we'll put the link on. I go into in-depth detail on hair restoration, FUE, FUT, and kind of the industry standards with respect to that. So I'll just jump right in with our model here. So one thing with FUE is you might hear it as scarless surgery. It's not scarless, right? We're just making little individual holes. They do form little teeny tiny dots, but they don't leave you with this linear scar that's kind of associated with the strip or the FUT, okay? So basically the concept is I use a drill, and there are various types of drills that are on the market. There are other types of FUE equipment that you might see on the internet, including the Artist Robot, which is a robotic FUE. So imagine a big machine that you get under and it does this thing automatically, right? Robot control. There is the assisted FUE devices like Graft, where they might have a suction on and there's a little pedal, and as you do the harvesting, it sucks the grafts into a little chamber that goes into the machine. For most hair transplant purists, meaning transplant practices that do high volume of FUE, they usually do a motor-driven, a hand device, right? So there's a pedal attached to it that drives this drill, and they do FUE in that regard. So that's what I do here. This is actually the WA. It's a Belgian device. It has a fluted punch if I were actually going to be doing it on a patient, but this is one of the more precise ways to do it. So the concept is you have the donor area, and we will touch on the safe donor area in a little bit more detail. That'll make sense later. But basically the safe donor area is the concept of where hair is going to always be present, right? If you see the baldest guy, they have shiny bald scalp, but they have that wreath of hair. That wreath of hair is technically part of the safe donor area. So when you transplant hair from the safe donor area, it lasts long. It's going to grow wherever we put it. You don't have to worry about it ever going away. When you do transplantation outside of the safe donor area, i.e. with FUE, because we got to scatter it out, then you may inadvertently have to harvest hair in areas that may over time go away. So that's that concept. Okay, the other thing with FUE is that there are different types of FUE. There's the no shave FUE, which basically means that the patient comes in, there's no shave, right? And you harvest each individual hair via long hair harvesting, right? There's also the short hair FUE, but basically what that means is, the team would go in, say the day before, and actually clip down each individual hair, and then the next day they go back and track those hairs down and they harvest that hair, right? The classic FUE is everything is shaved down. So keep that in mind. If you want to be more discreet, then you're going to be shaved down. If you don't mind being shaved down, then it's not going to be a big deal for you, because most of the guys that do FUE are already wearing tight styles anyway. So the concept is, here's my drill. I would typically wear magnified glasses that are like 4 times my vision, right? And then I'm gonna imagine this patient is shaved, and I'm gonna fire my drill, and I'm gonna go drill, 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 okay? And then those hairs that we have kind of freed up, we're gonna come in here and we're gonna locate those hairs, and we're gonna pluck out the follicles, right? So then you get an individual graft, right? Goes into the dish, and we're gonna target single hair grafts. We're gonna target 3 hair grafts, whatever the body is naturally giving us, right? And we're going to target those hairs, and then we're gonna transplant them. So here's another one that we drilled out, right? And then here's the last one. So 3 drills, 3 grafts, they come out. Now, what then happens is I have my team look at each graft under a microscope. They trim them, they make sure that the follicle is intact, that everything looks great, and that becomes a graft that we then transplant into our donor site. I mentioned the safe donor area in the other video. So what that basically means is that there is a defined zone of hair that is less likely to be affected by hormones or what typically causes hair loss in men especially. So if you look at the back of our skulls, all of us have a little bump that's called the occipital protuberance. The safe donor area essentially is a zone of hair that runs in proximity to that occipital protuberance on a horizontal plane, right? So through here, and typically extends up to the top of the ear, right? The perfect example is if you see the really bald guys that have that shaved scalp, right? Or they have a bald scalp, and then they have that wreath of hair, right? That's the safe donor area. That hair, everything else but that hair has gone away. Now, why is that even a concept? Because the concept of a strip surgery or FUT is based completely off of the safe donor area. That means I can take that strip, right? The hair is going to cover it up. I'm going to move that hair in anywhere I want to. Hairline, crown, facial hair, eyebrows, right? It's going to grow forever and ever, right? In contrast to FUE, when we harvest, we have to harvest outside of the safe donor area. That might put us in a situation where we're harvesting hairs from an area that may over time go away. Okay, so keep that in mind when you're trying to determine FUE versus FUT. Okay guys, so we just demonstrated what the concept of FUE looks like on the mannequin. Now we're going to show what the FUT or the strip looks like. Now mind you, we're concentrating on that safe donor area, which we just talked about. The length and width of the strip really depends on how many grafts we're going to harvest. So typically the first thing I do is just shave down a little area. I have a dermatoscope which allows me to calculate the number of hairs per square. Then I can calculate exactly how long and how wide of a strip that I need for said graft amount, right? If we got 1,000 grafts, then I can figure out, density in that. So we are really trying to be as precise as we can with respect to how much skin we take out, how much of a strip we need. We only take exactly what we need, and I try to minimize taking more for future if you decided you wanted to do more hair. So the concept with the strip is after we've marked it out, we've gotten it, we know exactly what we're going to take. Then I do some gentle numbing with lidocaine, so you're not going to feel a thing. And then we make an incision here, right, very precisely. Okay. And then once that's done, we take out our strip of hair, okay? So once we do that, it comes out as a strip, right? All the grafts are still in the skin that need to be dissected out. Then we take this is handed off to my team of very experienced techs. Under a microscope, they cut each individual hair out of the skin, right? So they're gonna be sitting here working, they're gonna be cutting perfect grafts of 1 hair, 2 hair, 3 hair grafts, right? And then after they do that, they end up with individual grafts out of the strip, right? That we are then going to transplant and wherever we decided to do that. Okay, so the last part of this whole process obviously is the implantation of the grafts, right? So you've seen FUE, you've seen FUT or the strip, you've seen kind of what we do with those grafts after we harvest each one, whether that's they go directly to the microscope to be kind of quality checked, right? Or the strip is given to the team, they put it under the microscope and they cut out each individual graft, okay? So now the last part of that is the implantation, right? So, say this patient has wanted their hairline lowered or a more refined hairline. So then we would have then designed kind of a hairline of their choice, right? We'll give them a little bit of a peak, which is considered one of the more important parts of the surgery, right? It's the artistic portion of where we're going to put your hair. So once we've determined, this is the area that we're going to transplant, Then those grafts that were previously dissected or harvested with FUE are then transplanted directly into the site that we're going to use. Now, the first thing I would do is make each individual hole where the grafts are going to go, and then we will transplant each graft until every hole is filled, right? Okay, so in these videos, we just demonstrated the difference with some details with FUE versus FUT or strip surgery. Certainly, if you have any questions or things weren't as clear, feel free to drop us a line. You can check us out at saratogahair.com. You can call our office, but we'd love to hear from you, and thank you for listening.